very much, Lindsay. I am Elaine Arkin. I'm with the Coordinating Center for the National Collaborative on Childhood Obesity Research, and I'll be moderating today's webinar. On the program today, we'll feature a spotlight segment using the SNAP-Ed evaluation framework in low-income nutrition education and obesity prevention programs. And then the second half will look at how the state of Arizona has used the framework for their SNAP-Ed evaluation plan. After the main feature, we'll have a brief one-on-one segment where you can ask questions of our presenters. So as you're listening to our presenters, you may be thinking about questions. And finally, we'll discuss a couple of upcoming events at NCORE. Now, if you need a technical assistance, you have a question for our speakers, first of all, a question for our speakers, please write it in the chat box on the right side of your screen. If you need technical assistance during the webinar, please let us know using the same chat box. We'll be monitoring that closely. And if you're having trouble logging onto the webinar but can hear us on the phone, please email us at ncore@fhi360.org. That's fhi360.org. And we'll work with you to resolve the problem and get you on the webinar. Finally, one more important technical note. If you've decided to listen to our webinar using your computer speakers, please turn down or mute your computer microphone so that we won't hear background noise. I think we'll all appreciate that, so thanks so much. We'll also be live tweeting today. If you're on Twitter or other social media, we encourage you to join the conversation by using the hashtag ConnectExplore and following the Twitter handle at NCORE. Now joining us today are Andy Naja-Riese, Laura Jacobs, and Theresa Gros. Andy is Chief of Program Integrity Branch at the Supplemental Nutrition Assistance Program at the Food and Nutrition Service for the Western Regional Office of USDA. Laurel is the lead evaluator for the Arizona SNAP-Ed program at the University of Arizona. And Theresa is an evaluator for Arizona SNAP-Ed, also at the University of Arizona. And they are together to present together in the same room today. Now, before we get started, we'd just like to take a little break here to open with a brief poll. You can see the poll on your screen, and we invite you to submit your answer directly on the screen now. And you can see we're asking if you're in the process of using the SNAP-Ed evaluation framework. Thank you to all of you who are filling this out. This will help our presenters know a little bit more about all of you. Okay, Yanni, you've got the results up here. And we can see that, and thank you all for doing this with us. We can see that a third of you have been using the SNAP-Ed evaluation framework for more than 6 months, so we're great to have you with us, and and also very happy to have you with us if you've been using it less than 6 months. That's about 20% of you. and particularly for those who want to learn more about SNAP-Ed and especially the framework. So thanks. And Andy, you know a little bit about our audience now, and I want to turn it over to you to tell us about using the SNAP-Ed evaluation framework.
Great. Thank you so much, Elaine, for the introduction, and thanks to all of you for joining us today for our webinar session. We're going to be talking about the SNAP-Ed evaluation framework, a new national framework that's useful in planning, implementing, and evaluating the success of low-income nutrition education and obesity prevention programs. And for our session today, we're going to spend the hour talking about the SNAP-Ed evaluation framework, how it can be used, how it can offer value to many different types of program practitioners. And we're going to also walk through the essential steps in using the SNAP-Ed evaluation framework for evaluating program success, partnerships, policy systems, and environmental changes. And what you can see here in the photographs, 3 of these photographs demonstrate actual real-world policy and environmental changes that have occurred in different types of settings that are part of our SNAP-Ed programs. Now, many of the participants on today's webinar are working in the SNAP-Ed community, but some of you are new, so I just want to offer just some brief information about SNAP-Ed for those of you who want to learn more. So 2017 will mark the 25th anniversary of the first set of SNAP nutrition education networks. So SNAP-Ed has been around for approximately 25 years, and it's gone through many different iterations over time. But the overall goal of SNAP-Ed has always remained the same in terms of focusing on improving the likelihood that persons eligible for SNAP and those residing in low-income communities are able to make healthy choices focused on their nutrition and their physical activity, consistent with My Plate, the Dietary Guidelines for Americans, and Physical Activity Guidelines for Americans. The SNAP-Ed program in FY17 has a total annual allotment of $414 million. And while SNAP-Ed is an optional program, all 50 states, plus the District of Columbia, Guam, and the U.S. Virgin Islands do operate SNAP-Ed programs. And again, while SNAP-Ed has gone through different iterations, the current version of the program that we're focused on resulted from the Healthy Hunger Free Kids Act of 2010, otherwise known as Child Nutrition Reauthorization, which expanded the scope of SNAP-Ed to focus on evidence-based nutrition education programs to be accompanied by policy, systems, and environmental changes to make it easier for SNAP-Ed eligible families to make healthier choices. And we layer on top of that social marketing to ensure that we're maximizing the message to reach many different types of stakeholders, both program participants themselves and other community and state leaders. The focus of SNAP-Ed, while comprehensive, continues to ensure that we're reducing disparities based upon race, ethnicity, income, and geography, where we see lower income persons disproportionately suffering from diet-related disease, obesity, and related limited access to safe places to play and to be physically active. When the Healthy Hunger Free Kids Act of 2010 was passed and state SNAP-Ed programs first started to fully implement a more expanded approach in fiscal year 2013, we relied on the use of the Social-Ecological model. And there's many different versions of the Social-Ecological model, but we use the version that's included in here. What you can see, the most recent version in the 2015-2020 Dietary Guidelines, which demonstrates that there's a constellation of different types of factors that begin with individuals, knowledge, beliefs, and attitudes, settings or the physical locations where people make decisions related to diet and physical activity, sectors, the large-scale systems throughout a state or throughout a country that ultimately impact policies and how funds are spent, and then lastly, social and cultural norms and values. They reflect the public's priorities related to what it means to be healthy, and that explains different types of decisions that leaders will make regarding how we want to invest our funding to make it easier for the SNAP-Ed eligible audience to make healthy choices. What we did with the SNAP-Ed evaluation framework is that we took the social-ecological model and translated that into a menu of 51 different indicators for measuring success in comprehensive SNAP-Ed programs. And while we're talking about SNAP-Ed today, the principles and the indicators and the practices will apply to many different types of nutrition education and obesity prevention programs. We also created, and this was released this year, an interpretive guide which explains how state agencies, researchers, and other partners can systematically track and measure the different types of indicators for measuring success in SNAP-Ed programming. Before we talk about using the evaluation framework, I want to ensure that everyone's on the same page when we talk about programs, policies, systems, and environmental changes. Through SNAP-Ed's approach, we layer as part of programming, we begin with direct education, or in some cases we begin with making changes in policies, either within a setting or an organization, or policies at a larger scale community, tribal, territorial, or state level. And we layer these different types of programs with education, learner-centered, skills-based, along with different ways to shape the environment so that way people, when they leave programs, when they leave educational sessions, they're more likely to act upon the educational messages that they learn. And we use a combination of policy, systems changes, and environmental changes to ensure that settings that are located in low-income areas and low-income communities where more than half of residents are eligible for SNAP are able to make it easier for people to make healthier choices. The SNAP-Ed evaluation framework grew out of a pilot project that started in the western region of the U.S., which encompasses 8 different states, along with the territory of Guam, which joined SNAP-Ed later on. What we started doing, it was during that first year, it was in 2013, when states that were newly implementing comprehensive approaches, including programs, whether it's educational programs or larger scale social marketing programs, along with policy systems and environmental changes, there wasn't necessarily a mechanism for states to be able to include this information in their state SNAP-Ed plans or to report their results and their accomplishments to FNS and other program stakeholders and funders. And it's important for our states to have a consistent set of processes for measuring through a systematic approach their outcomes and impacts. So what we found during a pilot year, we went through a process and developed a series of logic models. We looked at developing the short-term, medium-term, and long-term outcomes that we can expect from the different types of programs, policies, systems, and environmental changes that are part of SNAP-Ed. We learned during that first year, based upon what our states reported through their annual reports to the Food and Nutrition Service, that there was a combined 923 policy, systems, and environmental activities that were part of their prior year SNAP-Ed programs. Now, this was a very large number, and what we learned through this process is that, number one, states identify what it means to focus on adopting a PSE very differently, and just reporting the number of PSEs doesn't really tell you much about what the specific outcomes were, or understanding how did that particular PSE change make a meaningful impact for persons who either live, work, shop, or play in a particular community. So from the years 2013 through 2015, we learned from the Western region experience, which has since been diffused across all of the 7 regional offices of FNS. We learned from this experience, and through our partnership with the Association of SNAP Nutrition Education Administrators for ASNA, as well as through our partnership with NCORE, we were able to bring together more than 28 different states representing a variety of SNAP-Ed implementing agencies, including cooperative extension services, land-grant universities, other research universities, health departments, and nonprofits, to come together and create a flexible yet rigorous menu of options for state SNAP-Ed agencies to systematically measure and track their outcomes. Through the process, we learned from external partners. We brought together 25 experts, some of whom are working in SNAP-Ed and some of whom are outside of SNAP-Ed, to develop what are the ideal sets of indicators for measuring change in SNAP-Ed. And we also relied on information from our partners through the regional nutrition education and obesity prevention centers of excellence across the country to identify research-based strategies to include in the development of our national framework. Based upon prior evaluation models that have been developed, based upon practitioner input, we created a new national SNAP-Ed evaluation framework, which constitutes 51 different indicators of change resulting from comprehensive SNAP-Ed programs. There are different levels within the framework. We start with measuring changes among individuals. Then we move towards measuring changes among environmental settings, which are the physical sites or organizations where multi-component services are provided. And then we move towards sectors of influence, where we're looking at to what extent is SNAP-Ed working with other sectors, agriculture, government, media, and healthcare, to implement through a collective approach changes that will benefit entire communities, entire states, Indian tribal organizations, as well as Pacific territories. All of our activities within the evaluation framework respond to 5 different evaluation questions, looking at changes among individuals' dietary and physical activity behaviors. We look at changes in access and appeal within the physical settings or organizations where people eat, learn, live, play, shop, and work. We look at to what extent is SNAP-Ed programming working with other sectors and other partners to collectively impact and make changes within different jurisdictions. Then we focus on population results. So to what extent is the combination of programming, both SNAP-Ed funded and otherwise, contributing to broad-scale changes among the low-income population? And lastly, we focus on measuring to what extent do community-level obesity prevention strategies impact the public's lifestyle and related choices for what it means to be healthy. Much of what we do in the framework, while it's very complex, can be boiled down to the ABCDs. We start with doing assessments of looking at need and organizational readiness for PSE or related comprehensive change. We focus on obtaining buy-in from different decision makers, leaders, and community partners. Then we adopt and measure changes, and we assess those changes throughout the course of implementation and make mid-course corrections as needed. The D stands for disparities because, again, ultimately what we're doing is reducing disparities or inequities in access to safe places to play and healthy, affordable foods. And then the S stands for sustainability. When we adopt programs and policy systems and environmental changes, we want to ensure that they'll continue long after the time-limited grant funding expires. I'm going to walk through the different levels. So first we start with the individual level of the framework, which begins with assessing individual readiness capacity at the short term. We use different types of validated screeners, pre-post self-administered surveys. Then we move towards measuring changes. So looking at for program participants, to what extent are they adopting new individual behaviors for themselves or their families? And then ultimately we'll look at to what extent are these behavioral changes, do they stick after program completion? We use the definition through these stages of changes or trans-theoretical model to identify, do the behavioral outcomes at program completion, do they last for another 6 months? Environmental settings, we focus on policy systems and environmental changes. Again, we begin with organizational need and readiness. Then we look at the adoption of nutrition supports and physical activity and reduced sedentary behaviors. We focus on differentiating between adoption, meaning that adoption is when there is one or more change made in writing or practice, but we don't get to implementation or measuring effectiveness until there's a full-scale, multi-component, evidence-based program that may include PSE along with education and marketing. We next get to sectors of influence, which focuses on measuring changes made at the jurisdiction level. Here we focus on to what extent is SNAP-Ed working with other partners and adopting different types of changes that will impact multiple sectors, including government, agriculture, which includes farmers markets, farm to school and related, farm to where you are policies, education, community design and safety, social marketing, healthcare and public health linkages, and media practices. When we get to the sectors of influence level, we're not focused on measuring changes in one site at a time. That's what we do at the environmental settings level, where we go in and look at one particular site like a school or one organization like a school district. When we get to sectors of influence, we're looking at the degree to which broad-scale changes occur for entire communities, entire low-income neighborhoods, entire places that have been designated as high risk by the federal government, and so forth. We also look at changes for entire states, changes for Indian tribal organizations or Alaska Native corporations, as well as changes in territories. We next get to population results. Here we're focused on using different types of tools to measure to what extent is the SNAP-Ed and related programs increasing the likelihood that low-income persons are achieving the dietary guidelines and physical activity guidelines recommendations. Here we use different types of strategies. This can include the use of existing surveillance tools, such as those that are listed here from CDC and our partners. States can also set up their own processes for ongoing data collection, such as what occurs within the states of California, Maryland, Michigan, and Georgia, where they do repeated assessments of a representative sample of the low-income population. And here what we're trying to show, again, is to what extent is SNAP-Ed programming or the low-income population doing worse than, the same as, or better than the entire population to really understand is SNAP-Ed and related programming reducing disparities. In the interpretive guide, we present a format that includes information for each indicator. Now, each indicator is conceptual in nature, and there are different measures that are associated with each indicator. So think of the indicator as the broad concept, like healthy eating behaviors, and then for each indicator, there are specific measures, which are often associated with survey questions. We provide background and context, outcome measures, again, the specific benefit or improvement. We provide sample instruments on what to measure, and you'll hear more about that from Arizona in a bit. We talk about for whom the indicator is relevant, and live tools, and so forth. And I'm just going to walk quickly through this just to move on for the next portion. You'll really hear from Arizona about how they specifically use the SNAP-Ed evaluation framework. The most important point is for states to first think about what it is that they want to accomplish, what are their needs assessments, and what can their partners offer. So that way, SNAP-Ed, or when there's multiple agencies working on SNAP-Ed or SNAP-Ed's working with other partners, it's first important to think about what it is that you want to accomplish, what are your key goals. Then focus on using the framework to identify the specific goals or the specific indicators that will help you to plan for and achieve outcomes in your goal areas. You can walk through these particular steps on your own, but these will be included and are referenced within the SNAP-Ed Interpretive Guide, which is available on the USDA SNAP-Ed Connection. Before we turn it over to Arizona to talk about how they've used the SNAP-Ed evaluation framework, because this is a large, complex process, and choosing from 51 indicators is very ambitious and daunting, we provide information through practitioner stories. These are stories from the field, a variety of different states and localities that have used the SNAP-Ed evaluation framework. Here you can see an example from the Michigan Fitness Foundation and how they've used the SNAP-Ed evaluation framework for measuring their comprehensive approaches. You'll hear more about this from Arizona. In terms of next steps, if you have any questions about the SNAP-Ed evaluation framework, we developed a SNAP-Ed evaluation framework mailbox. We're also going to be developing a SNAP-Ed evaluation framework ambassador program for individuals that would like to learn more about how they can become a spokesperson for the framework. And we're also offering different types of training, tools, and technical assistance resources that are available on the SNAP-Ed Connection. So I do have my contact information here. We'll have more time for one-on-one, but we're going to turn it over to Arizona.
Thank you so much, Andy. And just before we go to Arizona on our trip across the country, just a couple of quick notes. Some of you are having a difficult time with your audio, and we encourage you to join the webinar by phone. The dial-in number is in the top box to the right of the slides, and also it's in the chat box. The number is 855-478-5375, and the passcode is 210-402-71. And also, several of you have asked if these slides will be available, and yes, we will be posting them early next week on the NCORE website. We'll give you more information about that. So, but if you're, we're sorry if you're having trouble with the audio, and please shift to the phone. If you have questions at any time for Andy or our next presenters, please do type them into the chat box as you think of them, and we'll be monitoring those. So with that, I'd like to turn it over to Laurel and Theresa. They are the evaluators for the Arizona SNAP Ed program at the University of Arizona.
Thanks,
Laurel
Elaine.
and Theresa?
Great. My name is Laurel Jacobs, and I am the lead evaluator for the Arizona SNAP Ed program.
And I'm Theresa Gros, program evaluator on the Arizona SNAP Ed evaluation team.
First, we'd like to share with you a little about the Arizona SNAP Ed program, which is known as the Arizona Nutrition Network and is implemented at the state level by the Arizona Department of Health Services. This current year marks the first in a 3-year work plan cycle for local SNAP Ed implementing agencies, with the opportunity to renew funding for 2 additional years. Our state has 2 main urban cores, but is also largely rural. We border Mexico to the south. We have one of the most populous counties in the nation, as well as 20 registered Native tribes. 7 county health departments and 1 cooperative extension represent Arizona's local implementing agencies, whose work plans are structured around 5 focus areas: food systems, active living, school health, early childhood, and direct education, which integrates into the other 4 PSE-focused intervention areas. Another change in Arizona SNAP Ed was the introduction of a new external evaluation team from the University of Arizona, which Theresa and I are representing today. We'll share with you our plan and our experience in applying the national framework to Arizona's own evaluation plan. Now, as we set forth to develop Arizona's SNAP Ed evaluation plan, we understood that the 4 new PSE-focused programmatic areas represented interventions at multiple levels of the social-ecological model. But where do we begin? The multi-year work plan that I mentioned previously offered us the opportunity to take a thoughtful and disciplined approach to SNAP Ed evaluation across time and across intervention levels.
We've seen that the socio-ecological model played in about the same time as the earliest version of the national framework. This meant that as both frameworks progressed, we were able to continuously scrutinize our plan for Arizona against the national one. We integrated the general structure and specific indicators from the national framework into our statewide evaluation plan. We refer to Arizona's comprehensive framework as our evaluation matrix. It includes an evaluation plan for each of the state's 16 SNAP Ed strategies that fall into our 5 focus areas. On screen is our plan for one of those strategies, Strategy 3, which covers farm-to-institution programs. Starting at about the center, you see the column headings for short, medium, and long-term outcomes that mirror the kind of progress through time we saw in the national framework. You'll also see that we incorporated indicators from the SNAP Ed framework shown in blue font, in a very deliberate way. Beyond that, we created 2 distinct tracks to accommodate policies, systems, and environmental approaches that occur at 2 levels outlined in the national framework. The single partner track represents work done at the environmental settings level, while the coalition track represents work done at the broader sectors of influence level. So for example, an implementing agency may be working with an individual school to promote a farm-to-school program. This is considered site-based, and so it falls into our single partner track, where the school is a single partner. But what if an implementing agency is instead working with a food systems coalition that includes growers, school, commercial representatives, and the deputy mayor to support farm-to-institution programming in a township? This multi-sector partnership falls into our coalition track, and it needs to be assessed in a different way than the single partner activity. As in the national framework, we expect that over longer periods of time, work done at both levels should result in population level change. So we see our population level indicators in the longer and longest term outcomes columns. So now, rather than looking at Arizona's evaluation matrix with elements of the national framework identified, let's look at the national framework and see how Arizona has chosen to address some of its indicators.
So as Theresa said, we're now going to flip the script and show you how the evaluation indicators and tools we selected for Arizona align with the national framework. In the big picture sense, you can see in purple the indicators that Arizona has selected for tracking SNAP-Ed's progress towards population results, supporting healthy weight, and the reduction of health disparities. It gives you an idea of the alignment over time from short-term through longer-term outcomes, as well as across each level of the social-ecological model. And in FY17, we'll be adding additional indicators as well. And finally, we have a snapshot highlighting the evaluation tools we've adopted this year and where they align with the framework. At the individual level, we've developed a youth survey with our cooperative extension called the CAN-Q, which is in the 4th of a 6-stage validation process. From UC Davis, we use the Adult Food Behavior Checklist and the On-the-Go questionnaire. At the settings level, we use Go Knapsack and WellSat 2.0 for early childhood and school health efforts, respectively. And those tools are referenced in the interpretive guide. We also developed a summer food checklist here in-house that we piloted this year to address a gap in tailored assessments for SNAP-Ed's role in providing summer food program support. And at the sectors of influence level, we evaluate multi-sector partnerships and planning using the Wilder Collaboration Factors Inventory, which is also referenced in the interpretive guide. Arizona SNAP-Ed has historically had a strong presence at the individual and settings levels, and consequently, we're evaluating medium-term outcomes there. Conversely, the program is still emphasizing readiness and capacity in the sectors of influence, and our evaluation tool there similarly reflects only short-term outcomes at this time. All right, folks, that in a very, very small nutshell is our evaluation plan for Arizona. So what have we learned? We've discovered that some evaluation components are thornier than others. For us, it has been school health because of the complexity of players and initiatives that are focused on children at school. Aligning our plan with the national framework has enhanced the credibility of our efforts here in 2 ways. First, the framework has provided our team with evidence-based PSE evaluation approaches that we can apply with confidence in this setting. Second, alignment with the framework has assured our stakeholders that our efforts are integrated with a well-coordinated and authoritative national plan. Second, we've found that our best evaluations change programming by amplifying the voices of some stakeholders whose voices may at times have been missed in the SNAP-Ed conversation. As evaluators, we may fool ourselves if we believe that our role is outside of the proverbial gladiator arena. In other words, that we are simply here to provide objective data to others who will then go forth. Rather, I believe that we have a specific yet important role in SNAP-Ed by virtue of what we choose to evaluate and which data and voices matter in that conversation. Here in Arizona, we've chosen to strap on our sandals and become evaluation gladiators by taking our mantle of data, our tools from the framework, and getting into the arena ourselves. And finally, we've received buy-in for our evaluation plans from local implementing agencies when we have shown that our methods are responsive to the realities of their programs and SNAP-Ed participants' needs on the ground. For every tool that passes through our hands, we ask ourselves, what will it feel like for the program staff to collect this information? What will it feel like for the SNAP-Ed participants? We practice utilization-focused evaluation, and this idea of using our evaluations to inform planning and implementation is a fundamental principle of the national framework as well. We strive to provide actionable data back to our stakeholders that they can use for decision-making and action, especially as they grapple with newer PSE approaches. Theresa is now going to share an example of the actionable school health data that our team has provided back to our local implementing agencies and how that is played out in one community.
So, it always helps to see how an evaluation plan can actually be applied to a SNAP-Ed program. Here we highlight a success story from one of Arizona's school health strategies that covers the support of school local wellness policies. This falls into our settings level. In fiscal year 16, we've been collecting local wellness policies from implementing agencies who work with school districts. We score the local wellness policy using the WellSat 2.0 assessment tool developed by the Rudd Center and provide the implementing agency with both the resulting scorecard and a set of recommendations to share with the district as they see fit. In this case, an implementing agency worked in conjunction with their local health department to provide these local wellness policy recommendations to the district. Not only was the district receptive, but the collaboration resulted in the emergence of a sustainable school health advisory committee that would be able to follow through with implementation. So that's just one example of how SNAP-Ed program evaluation, planning, and implementation can work collaboratively and iteratively to support what I would say is pretty rapid real-world change. Although we don't have time to cover everything that we do in all of the Arizona focus areas, we invite you to visit our website at nutritioneval.arizona.edu to learn more. And we also have a presence on Twitter where you can follow us using @SnapEdEval. And in the event that you would like to contact us directly, our email and Twitter handles are provided here. So thank you so much, Elaine.
Thank you so much, Laurel and Theresa. And before we get to the general questioning, there are two quick questions that have come in, and one is whether the, the summer food checklist is publicly available, and the other is whether the CAN queue for youth will be made publicly available.
So with respect to the Summer Food Service Program Supports Checklist, as I mentioned, we are right in the process at the end of our summer food season of wrapping up our pilot of this first year. My goal is that we would have a more robust tool after our pilot to share in time for next year's summer food service program. And I would encourage you to follow up with me directly if you would like to see some of the work that we've done there before next summer.
And regarding the CAN-Q, that stands for Kids Activity and Nutrition Questionnaire. As Dr. Jacobs mentioned, it's in the 4th stage of a 6-stage validation process. But at this time, we feel pretty comfortable with the findings that we've learned from the most recent round of validation efforts to make some small changes. We'll be working on those in the next 6 months. And after that time, we would like to make that publicly available to SNAP-Ed agencies around the nation.
Great. Thank you so much. And just quickly, what is the target age group for the tool?
For the CAN-Q, it's so far 4th to 8th grade. That's been working out very well, and it accommodates slow readers in 4th grade. So if they're under reading level, the reading assessment was in the 2nd grade reading level.
Great. Thank you so much for that clarification. Now we're getting a lot of questions in. And just a reminder, if you haven't had a chance to type in your question, you can do so in the chat box you see at the bottom right. And so let's get started. Andy, this first question is for you. And it is, in addition to building upon the evaluation plan's selected indicators with more data to evaluate progress year to year, do you expect that states would choose additional indicators to measure?
Given the nature of PSE and more comprehensive work, many of the results, particularly in the long-term or population results level, are going to take multiple years to occur. So it's really important to think through this process in a really strategic and linear model, to think through in 1 year, to think through what can you reasonably accomplish and what can be measured. So to think about what can you do based upon your needs assessment results, based upon your existing partners and your existing local champions, and then think through what are the types of changes that can be measured later on. So as we see more and more states and SNAP-Ed and other types of programs developing multi-year planning processes, you can use the SNAP-Ed evaluation framework to identify indicators for your current year as well as those for subsequent years. So you can think about it from a horizontal approach within a level of the framework, move from short-term to medium-term to long-term. You can also think about building out or scaling up your evaluation indicators to move from 1 year you might focus on measuring individual and family changes, then you might think about measuring comprehensive school-based or farmers market changes, and then in the 3rd year you might think about measuring broad-scale changes in a statewide agricultural policy. So it's definitely intended to be both an area you can scale up vertically as well as horizontally.
Great. Thank you so much, Andy. And Laurel and Theresa, over to you. How can you use the SNAP-Ed evaluation framework to evaluate the effectiveness of partnership activities or other activities that are related to the SNAP-Ed programs?
So this is Laurel. In the evaluation framework, there are 2 indicators that touch on partnerships. At the settings level, it's ST6. And at the sectors of influence level, it's ST8. I might have said ST6 for settings, but it's ST7 for settings, excuse me. And I would encourage anyone who's interested in understanding how to assess partnership activities to dive into the interpretive guide for ST7 and ST8 to take a look at what we've written there and how it may be most appropriate for your programs. In the time that we have today to answer that question, I'm just going to focus on community partnerships in the sectors of influence level, and that's ST8. I think we tend to think of coalition work as a means to an end, the thought process being, let's get a coalition together of like-minded partners to achieve some bigger goals than what our SNAP-Ed program might be able to achieve on its own. It's important to remember that the achievement of those goals is predicated on an effective coalition, not just the presence of a coalition or a collaborative of community partnerships. So what does effective mean? It means that the coalition, for example, is in agreement about what collaborative goals they're working towards, that there's enough resources within the coalition to move the goals forward, and that the community in which the coalition is working is at a moment amenable to making community-level changes. So for us in Arizona, it's been about shifting our evaluative lens to the coalition itself as the unit of measurement and investigation. We think that it's through a thriving and dynamic coalition that community-level changes are going to be achieved. And so those are the types of characteristics in a coalition that are important to measure. And that, in fact, aligns very well with ST8 to increase community capacity by better understanding multi-sector partnerships and planning. As I mentioned a few slides back, we use the Wilder Collaboration Factors Inventory because we think that's the most appropriate tool for our state's SNAP-Ed program. But definitely take a look at the interpretive guide. There's many different ways, tools, and indicators that you can look at to assess the vitality and the outcomes around community partnerships.
Thank you so much, and thanks to everyone who is taking advantage of the chat section. And I'm going to try to take the questions in the order in which they appear, but don't stop typing, because if we run out of time, we will respond to you offline after the webinar. So you will get an answer. So question, what have you proposed to assure that data quality standards including validity, reliability, precision, are met?
So I can start with that. This is Theresa. In Arizona, one of the first places that we looked was, at the time, a Western Region Interpretive Guide, which is now the Interpretive Guide to the National Framework, to review for recommended tools, most of which are heavily validated. And from there, we went to the literature and took a deeper look at every tool that we could find related to each of our focus areas and drilled down further to look at each of our strategies. And we work with not just the notion of accuracy as one of our guiding principles, but also feasibility and ease of use. So after we find validated tools, we also ask ourselves, is it realistic for an implementing agency to be trained on how to use this tool and then collect data? If it's not realistic, can our evaluation team train ourselves and collect data? And so each focus area and sometimes even a particular strategy will have gone through this process and had different results. In some cases, we administer or analyze ourselves, and in other cases, we have the implementing agency help, say, a site complete an assessment.
Great. Thank you very much. And we just have time for one more question, but keep typing, and we will answer questions offline. Here's the question. Have you developed indicators reference sheets? That is, sheets that define the indicator, the target, and the scope, and if so, where can we get them?
So what you can do is to visit the SNAP-Ed Connection website, which we included the URL in the PowerPoint, or you can Google SNAP-Ed Connection. You can download the interpretive guide, and the interpretive guide to the SNAP-Ed evaluation framework is over 300 pages long because it includes, for all 51 indicators, sample tools, data collection instruments, as well as preferred survey questions and other methodologies that can be used for each indicator. So if you're focused on measuring changes in government policy, we offer different types of secondary data sources that you can use for monitoring changes in government policy. If you're measuring changes for your State Nutrition Action Council, we offer different types of tools like the Wilder Inventory, the Coalition Effectiveness Inventory, the Partner Mapping tool to look at, does your coalition have the right resources in place for success? So all of the tools, references, and information about each indicator are available on the SNAP-Ed Connection in the Evaluation Framework Interpretive Guide.
Thanks, Andy. That interpretive guide is really a very deep and rich resource, so it's a great reference for everyone. Again, we're out of time for questions on the webinar, but we will track them, we will answer them, and they will appear on NCOR's website following the webinar. So just a quick few things about upcoming events. First, I want to thank Andy and Laurel and Theresa again, and all of you for your questions and your chats. It's been a really lively discussion. And so just to let you know that there is a follow-up webinar on September 8th on the SNAP-Ed evaluation framework. We encourage you to sign up for this one on strategies and tools for measuring priority indicators. You can see on the screen the date and the speakers. And again, please join us once again on September 8th. If you haven't, you can register right here by clicking on the link in the box to the right of your screen. Or after this webinar. So September is National Childhood Obesity Month. And to raise awareness, please join our Thunderclap and learn more about how NCOR is accelerating progress to reduce childhood obesity. You can join our Thunderclap by clicking on the link and signing up in the box on the right of your screen. The more voices we can have joining us that day, the bigger the impact. So it's also kind of fun. So please join us. If you have other questions about NCOR or upcoming activities, please email us at the Coordinating Center at ncor@fhi360.org. Now we're just about out of time, but I do want to note that all Connect and Explore webinars are archived for future viewing. If you have peers who were on vacation today and couldn't join us, please direct them to the website to find the webinar. You go to the Resource tab on our home page and then go to NCOR Resources and from there to NCOR Webinars. And you can also stay connected to NCOR by following us on Twitter and LinkedIn, visiting our blog, and signing up for our monthly newsletter. All of this you can do on the website. Now, I know we're almost out of time, but this is a very important slide, and we're very grateful for all of the people who have spent a lot of time, have devoted a lot of hard work to making this evaluation framework possible. It's just a fabulous resource. Particular thanks to Andy, who would not have put himself on this, who really has been the backbone of this. But without the time to read everyone's name, we're very grateful to you. Now, once again, thank you to our guest speakers, Andy, Laurel, and Theresa, and to all of you who have joined us today. We're very happy that you were with us. And before signing off, please take a moment to complete our brief 6-question survey. Your responses will help us to help shape future webinars and make sure we make the best use of your valuable time. So we're going to switch over to that feedback form now. You can write your input directly on the screen and hit submit. And please have a great afternoon and a happy weekend.